Chapter 5, Medicaid, TRICARE, Workmen's Compensation, and Discount Cards. After completing this chapter, you will be able to identify the way Medicaid programs vary from state to state. You will be able to discuss Medicaid prescription coverage. You will be able to know who is eligible for TRICARE and what kinds of TRICARE there are. Workmen's compensation, who is covered and why do they have it, and discount cards and who is covered. Medicaid is an assistance program. It is not an insurance program. It's an assistance program that pays for health care services for people with income below the national poverty line. Both the federal and state government pays for Medicaid, and in some areas, the local tax supports it as well. Each state participates in their Medicaid program in two ways. They may authorize additional kinds of services or make additional groups eligible, and they determine eligibility within federal guidelines. Because of this participation by state governments, Medicaid programs change often and are varied widely from state to state. Pharmacy technicians must become familiar with their own state rules and requirements. The coverage for Medicaid is very widely. There are several types of ways that the Medicaid covers. It covers physician services, it covers laboratory and x-rays, inpatient and outpatient hospital services, rural health clinics, that is clinics that are out in the boonies that we call them, in rural areas, home health care, family planning services, skilled care and public nursing facilities, prenatal and nurse midwife services. It also covers early detection or periodic screening, diagnosis, and treatment, and emergency care. The state portion of Medicaid often includes a number of additional programs under its federal funded Medicaid program. And some of these examples are clinical or clinic services, emergency care, eyeglasses, ambulance, prescription drugs, chiropractic services, mental health services, among a lot of them. They are listed on page 96 and 97 in your chapter. S-CHIP is the state children's health care program. Ours is called LCHIP for Louisiana Children's Health Insurance Program, and it's a part of the Balanced Budget Act of 1997. This act requires states to develop and implement plans for health insurance coverage for uninsured children. This program is also funded by federal and state governments, and it covers children until they're 19 years old. Again, the eligibility for Medicaid is people with low incomes who have children or are over the age of 65, are blind, or have permanent disabilities. Within federal guidelines, state determines income levels and other qualifications for eligibility. The Welfare Reform Act is a law that addresses the needs of categorically needed Medicare recipients. Okay, I flipped my slide too soon. Instead of going back and recording all that, we're going to talk about the Welfare Reform Act that I started talking about on the last slide, and then we'll get into the TRICARE and CHAMPA. Welfare Reform Act is a law that addresses the needs of categorically needed Medicaid recipients. Some states extend the medical eligibility to include another group, which is the medically needed or medically indigent. These individuals earn enough money to pay for basic living expenses, but they cannot afford high medical bills. In some cases, Medicaid recipients in the medically needed classification must pay deductibles before they receive the benefits. Different states authorize coverage for different lengths of time. Some state issue cards twice a month, some once a month, and others every 2 months or every 6 months. Most states, however, are moving to electronic verification of eligibility under the Electronic Medicaid Eligibility Verification System. Because of the change in eligibility, the pharmacy technician insurance specialist is to alert the checking these 3 points. Check the eligibility, check the pre-authorization, if they have drugs that are pre-approved, and then other insurance coverages. If the patient is eligible for Medicaid, and has additional health coverage through the insurance plan and other government plans such as Medicare, the patient's Medicaid eligibility did not relieve the other program or plan of responsibilities. They're the secondary. So if they have an insurance, it will be included as the secondary insurance. So you will bill the um, primary first and then the secondary, which will be the Medicaid second. TRICARE and CHAMP VA kind of go together. TRICARE is the Department of Defense health insurance plan for military personnel and their families. There's different types of TRICARE. You have the TRICARE Standard. It's the fee-for-service program that it covers medically necessary services provided by civilian physicians with an individual not obtained treatment from military treatment facilities. This means they went to an outside doctor and not saw the doctor that's on base. The TRICARE Prime is a managed care similar to an HMO. After enrolled in a plan, each individual assigned to a primary care manager who coordinates and manages the patient's medical care. Then you have the TRICARE Extra. It is an alternative managed care plan, kind of like the Medicare Part C, for individuals who want to receive services primarily from a civilian facility and physicians rather than the military services. Since it's managed care plan, individuals must receive this healthcare service from select work of health network professionals. They also may seek treatment at military facilities, but active duty personnel and other TRICARE Prime enrollees receive priority of those facilities. So care may not always be available. Then you have the TRICARE Reserve Select. This is the one that came after September 2011 when we had the World Trade Center accident. Well, not accidents, when that happened. This is when this one came in. And what it does, it's a premium based health care available for purchase by certain members of the National Guard and Reserve activated on or after September 11th. It provides members and their covered family members with comprehensive health care coverage similar to the TRICARE Standard and the TRICARE Extra. Then TRICARE for Life, it was initiated in October 2001 and to fulfill a promise made to many military personnel at the time of enrollment that they would receive lifelong health care. Most of these people in the TRICARE for Life are 65 or older and in situation with multiple potential payers. Medicare pays first, followed by many other health insurance and remaining beneficiaries liability, and then TRICARE for Life is paid. So if they're 65 or over, of course they have Medicare. So Medicare pays first. Then the TRICARE for Life will pay after everything else pays. Then let's talk about CHAMP VA. CHAMP VA is the Civilian Health and Medicare Program of Veterans Administration, which is known as the Department of Veteran Affairs. This government program helps pay for health costs for families of the veterans who are totally and permanently disabled because of service related to injuries. It also covers the surviving spouse and children of a veteran who died from the service related disability. Some surviving spouses of service members who died in active duty may be eligible for CHAMP VA. In 1996, there was a Veterans Health Care Eligibility Reform Act. It required veterans with 100% disability to be enrolled into the program to receive benefits. People that are qualified for TRICARE and CHAMP are called beneficiaries. They get identification cards, and these are what are handed over to the pharmacy to let the pharmacy know who to bill. Workmen's compensation insurance is a plan that provides benefits for someone who is injured accidentally in the course of performing work at a work related duty or becomes ill as a result of employment environment. The workers' compensation covers two kinds of situations that require medical attention: a traumatic injury or a non traumatic injury. Compensation for work related illnesses and injuries may be one of the five types. It may be medical treatment, lost wages or temporary disability, permanent disability payments, either partial or full disability, compensation for dependents of employees who are fatally injured, and vocational rehabilitation. So when someone is under workman's comp, sometimes they have a card, sometimes they don't. Um, they have to provide the information to us through their work, through their employer, and it is our job to keep this stuff, keep it, keep their identification and the workman compensation under the HIPAA law to keep it confidential. We have to make sure that we do this. It's always going to be a third party. The pharmacy technician specialist should verify the patient's coverage on the workman compensation by contacting the patient's employer and asking for the name of the insurance carrier. The carrier should then be contacted to find out what information is needed in order to process the claim for the prescriptions. So we have to contact them in order to get where we processing the insurance through. And they're gonna also give us like a bin number and group number and all that we would need to process it. We have to have that in order to process it. So sometimes the only way of getting that, if they don't present us with a card, is contacting the employer. Discount cards. These are offered by states to people who cannot afford prescription plans. You see a lot of these commercials. The one that I can come up with is GoodRx. That is a discount card that people can pull up and automatically save on drugs. Um, People that's 65 and older who do not have prescription drug coverage, who are covered by Medicare, but fall into the program's prescription drug coverage gap, the donut hole that I talked about yesterday, they could be people that would receive discount cards in order to help them cover their medication. Discount cards offer savings that depend on other drugs. So we have to it's kind of like what's hot, what's going today. You always have the discount cards for the drug, the incoming drug, or the drug that everybody's promoting. A drug rep, they also pass out discount cards. We used to have them at the pharmacy, but it's against HIPAA law now to give us the discount cards to give out to patients. So they have to get those cards from their doctor's offices or straight from the manufacturer. GoodRx is a good one that people get, and it actually covers a lot of different drugs. Okay, so that's the way Medicaid works, workman compensation, TRICARE, and CHAMP VA, and you kind of will not get the experience you need unless you're in the lab or you start working at a pharmacy. So again, I want you to answer all the tech check questions within the chapter and submit them as an assignment. And if you have any questions, you can always call or contact me via text. Thank you.